Welcome to Busy Mom Talk, real talk for real moms. I'm your host, Kia, mom of two. So if you're juggling kids, coffee, and chaos, you're in the right place. Let's get into it. The information, opinions, and recommendation presented in this podcast are for educational purposes only, and every individual should seek medical advice from their own medical professional regarding their medical status. Welcome back to another episode of Busy Mom Talk. Today we have Dr. Shazma Mithani, and I'm so excited for everybody to hear everything that she has to say. She also does have a podcast, so definitely go to check that out. But do you want to give us a little introduction of who you are and what you do?
For sure. Yeah. Thanks so much for having me today on the podcast. I'm an emergency doctor in Edmonton. So I work with both adult and pediatric patients. I also have lots of social media content kind of related to educating the public on different health issues. So my handle is at Dr. Shazma Mithani. And as you mentioned, I also have a podcast called the Doc Talk Podcast with my co-host, Dr. Sheila. She is a family doctor in Toronto. And so between the two of us, we have a pretty broad kind of knowledge base to cover lots of different health topics. So we just finished our first season about a month ago, and it's been really exciting.
It's so exciting and great to see also somebody who is a mom be able to work in a field that you get to deal with so many different moms, children, and so many different types of people.
Yeah, I mean, it's definitely been interesting to see. So I have two young kids. My youngest is 6, my oldest is 9. And it's been really interesting to see because I started medicine before having kids, and started as an attending before having kids. And there's certainly been an evolution of like not only how I approach medicine and approach different patients, but also how things land on me differently. Being a mom, it kind of changes your perspective on life. So it's been a very interesting journey to reflect on how things have changed as I've become a mom and as my kids have gotten older and gotten into different things and how that changes how I move through medicine in my career.
For sure. I always say that like once you become a mom, it becomes a personality trait.
Yes, absolutely. And it like very much affects the way you look at everything in the world. For me as an emerge doc in particular, I see dangers everywhere. I kind of wish that I didn't see things that way, but it's hard to unsee things after you see some things at work and then not kind of see that in the world around you too.
So maybe let's kind of start from the beginning of your career. Like what made you get into medicine? How did you find this career? What kind of was your road?
I was always kind of interested in biology and science. That was like definitely what I was most interested in junior high school and high school, but I didn't really know what I wanted to do with that. Initially, when I finished high school, I did pharmacology, which is how drugs are developed, how different medications are developed. And so that would have put me down like a research and development path if I'd continued down that. And so I did research for the first couple summers of undergrad and honestly just realized that it wasn't for me. As much as I thought that I wanted to do that, it just wasn't resonating with me. And so I started looking at other career opportunities in the kind of biological sciences field. And medicine felt like the right answer for me because although I really liked science and the human body and the research side of things wasn't really for me. And I really wanted something that was more people facing. And so that's when I started to pivot and pursue a career in medicine. And so I finished my undergrad at the University of Alberta. And then I went to medical school at Western in London, Ontario, spent 4 years there. And then during that journey, I initially actually went into med school thinking I wanted to be a pediatrician and then ended up doing my emerge rotation. And as cheesy as it sounds, it just felt like home. It felt like really like what I wanted to spend the rest of my career doing. And so I came back to Edmonton and did a 5-year residency in emergency medicine. And then I've been here practicing since then.
I find that so many people that I talk to in the medical field, they say that they've always just had this idea since a child or something that just called them to it. And it wasn't just something they woke up one day saying, oh, I'm going to be a doctor or I'm going to be a nurse. They just always knew they were going to somehow be somewhat in that field.
Yeah, it was certainly an evolution towards that direction for sure.
So what would you say is something that you see so commonly in the ER? And I know you see probably so many different things, maybe mom related, kid related, kind of in that degree.
From a pediatric standpoint, like a mom and kid related, one of the most common things I see is fevers. So parents coming in, their child has a fever and they're concerned for a few common reasons. a few of the most common reasons I see people come in with, or parents bring their child in with a fever, is because they're worried about the actual number. So they're like, oh, my child's fever is really high. It's 40 degrees, and I'm worried that it's too high of a number. That's a common one. First time parents where their child is having a fever for the first time and they're not really quite sure what to expect and what's normal and what's not normal. Those are kind of the two most common reasons people come into the emerge with a fever because they're worried about what that fever might mean. And so a lot of those situations, thankfully, fevers are really not dangerous. And so it requires some education, which I really enjoy doing. I enjoy talking to parents and educating them about their child and what's normal and what's not normal, and just some reassurance as well, and kind of what to expect and when it is important to come back to the ER.
I find too, when you're a first-time mom, like I know for myself especially, I would call my doctor over every little thing from like my 6-month-old baby has what I think is like a ingrown toenail that's getting infected. And you think so many things. Then with your second, you're a little bit more lenient. You're like, okay, they're gonna be okay. They're gonna get a fever, they're gonna get a cough, they're gonna get a cold, and you're kind of more relaxed, I would say.
Well, it's funny that you say that because even as someone who is like literally an expert in this area, when my kids have been sick, I can't make objective decisions. I have to. So my husband is non-medical and I have to ask him. I'm like, well, what would you do? He's like, why are you asking me? You're a doctor. You're literally a doctor in this area. I'm like, no, I cannot think about things objectively. I always like jump to the worst case scenario. And so there have been times where yeah, where my kids have been sick, usually with like fevers or other things. And I'm like, okay, well, so like at what point would you bring them in to see the doctor? He's like, why are you asking me this? I'm like, I don't know. Like, when do you think is the right time? Because I actually can't, even as like a mom and as someone who's an expert, I can't, when it comes to your kids, it's really hard to think objectively about things.
I could understand that because I think when it's your own child and everything that you see on a daily basis, you obviously jump to like the worst case, or you're working with these people and these children firsthand. So you're seeing how quickly things could turn, or, so
Hmm.
it does make sense.
Yeah. Okay. So thanks for validating that. I also will like, if it's not my husband, I'll ask like a couple of my good friends who are also in the emerge kind of field, and we'll kind of bounce things off of them as well, being like, okay, so like, what do you think? Like, when should I take them in, or what should I do? And so we have like this little group that will do that too. So it is nice to have that.
The one thing that I find frustrating as a parent, though, is when you call telehealth or, you can't get in contact with your doctor. I have a really great doctor. We have an on-call physician. So we're really lucky that way. But I've had to call telehealth a couple times just because my doctor is further from us. And they always say to me to go to the ER. And
Hmm.
I feel like the answer isn't to go to the ER, but I need some guidance. So it's frustrating.
Yeah, I have to agree. As a provider as well, I find some forms of telehealth really frustrating. And so I think it's important for the listeners to kind of delineate that there are different types of telehealth. And so there are what I call virtual walk-in clinics. So it's a doctor that doesn't know you, that has never seen you before, and it's essentially like going to a walk-in clinic, but it's virtually. And those are the ones that I find honestly the most frustrating because there is no continuity of care. It's a doctor who doesn't know you at all, may not even be in the same city as you, probably isn't in the same city as you, doesn't know what the health system works like in that location, and doesn't have the ability to examine you, has no context. And so the safest thing to do is to say, go to the emerge. And I get the safety piece of it, but those are a lot of emerge visits that could have been avoided, even by just going to a physical walk-in clinic where someone can examine you and look at you. Versus there are a lot of virtual health options that are available like within a doctor's office, right? So if you're part of a practice or you have a group of doctors who, you might be seeing one doctor in that practice, but there is a group of physicians that are there, they can offer virtual appointments. Like I've had virtual appointments with my own family doctor to discuss results or those sorts of things because it doesn't, it's like more just a conversation that we need to have. And so it's a time saver for both of us, for me, rather than me driving there and her having to, see me, we can just have a phone call about it. Or there is virtual care that I provide in the province of Alberta. So it's actually through our provincial health system. So it's like not a private entity. It's through when you call HealthLink or 811, which every province in Canada has. There's a virtual option where you see physicians who are family doctors or emerge docs that are based in Alberta. So it's like only a certain number of things that get seen by these doctors. We get to have a Zoom call. We have access to order tests. We know the system that we work in. And so the evidence for those types of things have actually shown that it decreases emerge visits rather than pushes people to the emerge. And so I would say, like, yes, definitely frustrating, but it depends on what type of telehealth setup it is.
So I think the one that I'm referring to is the first thing that you were talking about. It's
Hmm.
just like some random person on the other end.
And there are a lot of those. Those are popping up a lot more.
Yes, so I think I just seen something similar to what you have in Alberta in Ontario. So I'm closest to CHEO, but I know Sick Kids does it, that you can do like a ER visit with somebody such as yourself, like a physician that's in the ER or a family doctor. Um, but I think that, yeah, when you're a first-time mom, you think everything is kind of ER visit worthy. But I don't
For
know, with my
sure.
second, I would just always be so scared. Like she's gonna get sick from going to the ER for just a cold or, So I was so big on like, I have an amazing family doctor. He also was an ER doctor. So I think that gives me a little bit more like validation of like, okay, if he tells me it's ER worthy, then okay, I'll do it. But
Absolutely.
there's just so much online too with social media. I'm sure you get that parents coming in, they're like, I seen this online and there's all these issues or.
Yeah, it's like the classic Dr. Google thing, right? I've seen a few memes floating around on social media lately of like, ask Dr. Google, and the answer to everything is you're dying, which like it's really easy to go down the pathway or the algorithm of this is something really bad. And so it's tough because access is a challenge in a lot of different parts of the world. It's in Canada, where the two of us are, access is a big problem. There are like over 6 million Canadians that don't have access to a family doctor, and so there are other pieces of the puzzle that have to be leveraged. And if you are worried about something and you can't get into your family doctor in a timely fashion and you don't want to go to the emerge, I completely understand why people turn online to look for things. And so whether that's searching something on like ChatGPT or some sort of AI search engine or Google or going to social media, there are inherent risks in those spaces because it's really hard to know what to believe and what not to believe. And, as we know in the social media space in particular, there's a lot of misinformation that's continuing to grow. And it's really hard to, as a consumer of that information, know what's real and what isn't, and what's true and evidence-based and what isn't.
What would you say, like, given that social media does have so much misinformation, what do you see in the ER per se that's the most concerning that people come in saying, I seen this online or this is what I've seen or
Yeah, the biggest thing is just a general rise in the mistrust in medicine, because of, lots of social media influencers that are out there, and lots of now, especially with the US having an influence on Canada, with their Secretary of Health, there is a big push towards a mistrust in medicine and this move towards natural is better. Listen, I like natural is great, but like natural things are bad too. Like it's not just one or the other. Um, there's a big rise in vaccine hesitancy and vaccine misinformation. I mean, we're seeing this I'm in Alberta. It is now the measles capital of North America, unfortunately. And a lot of that is because of a rise in mis and disinformation and a mistrust of vaccines, which is really scary and sad to see because people like young babies and young children are being negatively impacted by this. And so, yeah, like just a general mistrust. And then like in particular, vaccine hesitancy has certainly had a big impact on how health is delivered and what I'm seeing in the emerge too.
I understand that completely. And my doctor, when I first had my child, he said to me that natural things are great. His son's a chiropractor, his daughter-in-law is a naturopath. He does acupuncture himself. His wife does Reiki. And he's saying there is a place for natural medicine, but do you want Dr. Google giving you a surgery? Do you trust Dr. Google enough to give you a heart surgery that's going to fix everything? And, he was saying to me that sometimes that you have to have this balance, but Western medicine's there for a reason, right? And we've come so far.
And I have to agree. I think that it's like it is a continuum, right? And there is a balance. And I think that both things can be done integratively together. It's not one or the other. And I think a lot of what's out there right now is that it's like, well, if you believe in Western medicine, it's only Western medicine. If you believe in, naturopaths and supplements, that's the only answer. I truly believe that there is like a balance in the middle. Get vaccinated, but also, if you want to treat your treat your symptoms symptomatically with some natural remedies, like sure, great, but also like talk to your doctor about it too, so that they know what you're using, what's happening. If it's something like cancer treatment, for example, because there's a big rise in mis and disinformation with that. I don't know if you've watched the series Apple Cider Vinegar on Netflix. Like that was
No, I
a
haven't.
really, it's a really stark illustration of how dangerous the rise of misinformation can be. And so, briefly, without any spoilers, it's about this woman in Australia who lied about having cancer, said that she was cured from cancer by like juicing and kind of a whole food diet, but she was lying about having cancer to begin with. And it showed that it had like significant negative impacts on how people were deciding to treat their serious illness because they believed that she fought cancer naturally. I think it's important to like that you can complement your cancer, like your chemotherapy treatment, your radiation treatment, your surgery treatment with other additional things, but to completely move away from evidence-based medicine in favor of natural alternatives, I think is really dangerous. And we've seen, I've certainly seen very poor outcomes um, in the emerge of people, coming in with end-stage cancer where they haven't received chemotherapy or surgery or radiation and have opted for natural remedies only. And unfortunately, only natural remedies don't work for cancer. And so they end up having a shorter lifespan and a worse course because of it. And it's really sad to see.
It must be hard, especially given that you guys go through so much studying and so many years of trying to make this more accessible or, like the research is there. And yeah, I understand how that'd be frustrating. I do wonder though, where do you suggest parents go for like evidence-based research regarding medical issues?
Yeah, that's a great question. And I think it's really hard to often delineate what is reliable and what isn't. And so, what I'll often say is, I mean, if you can avoid going on social media for health information, I would, if that's where you want. I mean, I'm in that space for that reason because I know that people go to social media for health information. And so, always look at who you're getting the information from. Is it a government funded organization, for example, like the CDC or the WHO or Health Canada, where we are? We know that then there is like unbiased research heavy information in those spaces. If you're searching on the internet or on social media, look at the credentials of the person that you're getting information from. Is it a physician? Are they trying to sell you something? If they are trying to sell you something, that is like red flag number one. If someone says, if it's someone that says that they're in the health and wellness space and are an expert of some sort, are they saying that there's this supplement that fixed something for them? And then, click on the link in my bio and you can buy the supplement from me. So like if somebody's trying to sell you something, that is red flag number one, approach with caution because there's heavy bias in there. Um, Look at what, like look up the person, like if you find an account online, look them up, search them on Google. Are they a physician? Are they some sort of like registered professional? So are they a physiotherapist? Are they a registered dietitian? Or are they just a wellness coach, right? Which isn't actually a regulated term. Another common misconception is like the word nutritionist is actually not a regulated term versus dietitian, where they are actually part of a college and are a regulated profession. And so being more aware of what labels people put on themselves and whether they're actually professional designations versus something that someone can just call themselves after like a weekend certificate. And then the last thing is like asking yourself if it sounds too good to be true. It honestly probably is. Everybody like in the day and age that we're in, we all want quick answers and quick fixes. But unfortunately, when it comes to health, most things are not quick fixes. They take time, they take time to figure out, and then time to manage and time to treat. And so, if it's someone that's trying to sell you a quick fix or is trying to promote a quick fix, it's probably not the right answer either.
That does make a lot of sense. And I think as I'm a master's student, so I understand how research works and I love PubMed. I go on there more probably than I would Google stuff. But I never had any of these skills until I got into post-secondary. So I didn't really understand how research worked or when people say, "Oh, I researched this and I know this," and they're just getting their information from like Google and they're not realizing where this information is. And it's like I think that with everything in society, it's so hard to even trust where to get the information from that it sends people spiraling. And then
Hmm.
as a mom, like you're already like in such a stage of fight and flight when you're postpartum and your baby's sick now, or your older children are sick and you don't know what to do and you can't get access to a doctor. So I think it makes sense, but it also it's so scary. Like,
Yeah, I think that's you bring up two really good points there. One, the research piece. I think that until you are in a field, so like you doing a master's, me having done like a bunch of post-secondary and medical school and residency, where they teach us how to evaluate research critically, look at things like how many patients were in a study, what kind of outcomes were they looking at, what sort of statistical analysis did they use? Like these are all important things to decide whether a study is valid or not. It's not just as simple as like reading an abstract or like reading a Google article. There's a lot of rigor that goes into deciding what is valuable and what isn't in the research space. And it actually takes education to learn how to do that. So I think that's a really important point that you bring up doing a master's program yourself. The second thing that I think is really, really important is you talk about how things are really scary. Health is so vulnerable. It is like one of the most vulnerable things that we experience as humans. And unfortunately, the problem with that is that people have figured out a way to capitalize on that. When somebody is scared and worried about their health, and like I said, people just want like quick answers or want to know what's going on, there are people out there that prey on these individuals and take advantage of them because they are using it to essentially like sell their snake oil, so to speak, right? Like, well, this supplement's going to fix you. And when people move through like Western medicine and they aren't getting answers as quickly as they want to or don't feel heard, to me, it's not surprising that they're looking to other spaces. I think as medical professionals, we need to do better too to work with our patients and meet them where they're at, and be able to help them understand that it's some things take time. Like diagnoses take time. It's not, some things are easy to diagnose, like a heart attack or appendicitis. Like there's a test for that and it's easy to figure it out. But most things in medicine and in health are actually slower diagnoses, and it takes some time to do tests and put puzzle pieces together. And sometimes it's important even to just like stop and have that conversation with our patients so that they understand that it's not that we're just brushing them off, that things sometimes take time, and hopefully that brings people back to medicine versus pushing them away to other things.
yeah, that does make sense. And I think too that a lot of times people think they're going to go into the ER and be seen right away because to them it's the worst thing possible. And
Hmm.
so when I was pregnant with my son, I was hospitalized for 4 months with a enterococcus antibiotic resistant infection in my kidneys. So I was there
Hmm.
quite a bit, but I would often see people being so frustrated in the hospital saying like they came in and they're in 10 out of 10 pain and they're not being treated first. Like I think that a lot of times people will leave and then they'll come back because of the same thing and they'll leave because they don't want to be waiting. And I don't know if the wait times are as bad in Alberta as they are in Ontario, but I went to the
They are.
ER. Yeah, I went to the ER in the fall because I had really bad pneumonia, but I also have asthma, so it just exacerbated everything. And it was like an 18 to 20 hour wait time. And it was like a normal thing. And like where I'm from in Hamilton, they have urgent care centers. So I used to always say,
Hmm.
if you're not going to die, I'm going to go to the urgent care center. If I don't think I need surgery, I'm going to go to the urgent care, right? And it's just it's just scary because again, when you're in the waiting room, you're hearing things, people are talking, and
Hmm.
when you're already in pain or things aren't going right, you just start to kind of again spiral.
Absolutely. And I think you hit the nail on the head when you say like when people come into the emerge, the way that I kind of think about it, it's like one of the worst days of their lives, right? For most people. They're worried, they're scared, and it's hard to when you're in a state of feeling uncertain and scared, it is very hard to think objectively in that state of mind. And so when you see people around you that are going in first, probably truly because we have a triage system and they are in fact sicker, like that's why people get brought in right away because they're often really, really sick and at risk of dying or deteriorating very quickly. It is hard to see people go past you. And I have a lot of empathy for that. I've had to wait in the emerge myself and with my kids and with family members as well. And so I have a lot of empathy for that. And it's hard to have um, to try to think about things objectively and calmly. It's honestly pretty much impossible to do that in those situations. And so, whenever I do have a chance to see patients, when they do end up coming in, like I try my best to show a lot of empathy for the fact they've had to wait for a long time because unfortunately, we have really high volumes in the emerge. And when people don't have access to family doctors, not only to be seen in the moment, but to give them preventative care to prevent them from getting sicker from their chronic illnesses, we end up seeing higher emerge volumes, unfortunately. And that's kind of the state that a lot of provinces in Canada are in right now.
Yeah, and something that actually surprised me was I seen a ER physician from Hamilton post that he gets yelled at 8 out of 10 patients or something because of the wait times. And I remember watching that video thinking, oh my goodness, like people actually yell at them. And I remember even when I was in the hospital with my giving birth or when I was pregnant with my first, I would always say thank you to the nurses. Like I was very big on making sure the nurses felt like I was actually appreciative. And they would always say, well, no one said thank you to me all week. You're the first patient who said this. And it just made me like open my eyes to think of how crazy this is because I always think that a lot of times people think, oh, doctors make all this money or whatever, but they don't realize doctors work 12-hour shifts, 24-hour shifts. They have large bills of medical school. And, like it is very, I would assume, draining mentally, physically, working as a doctor.
Yeah, it absolutely is. And in particular, emergency medicine is the highest burnout specialty that exists in medicine, because of all these things. Not only like the patients that there is a lot of like verbal abuse from patients for sure. And again, like I try to give, not that it's okay, it's not okay, but I try to give some grace because a lot of these patients are so scared and so worried. But also just from the things that we see from the terrible cases and terrible outcomes that we end up seeing in emerge because it's the sickest of the sick of patients that are coming in. It's a lot to carry and a lot to kind of yeah, to manage. It's definitely a very like high moral injury and high burnout specialty. Another, we talked about apple cider vinegar, but a show that I think is a really good example of the burnout of medicine and what emerge is really like is The Pit. So that stars Noah Wiley. I don't know if you've watched that show, but it is like the best medical show I've ever seen in my life. It is so accurate. It is medically accurate as well. They actually have a team of consulting emergency doctors that were like helping with the writing so that everything was accurate. And it is, yeah, it is for anyone who is not in medicine, I would say it is a must watch and very, very eye-opening in terms of not only just doctors, but nurses, learners, social workers, paramedics, police officers. Like it's the spectrum of people kind of in medical care that you get to see glimpses into their lives and kind of what we have to go through every day with what we see in the emerge. It's very, very well done.
It's crazy that you say that because I only really watch medical shows or law shows. Those are like the only two things that I really like. But I've always wondered, do nurses and doctors enjoy medical shows because is it actually the reality they live, or is this like a fake reality, you know?
It's like they're like soap operas, except for The Pit, because again, like it is truly like the most accurate show I've seen. The second most accurate, I would say, is Scrubs. That's also a really good show, but everything else, like even the original ER, Grey's Anatomy, all of these other House, like all these other shows, they're just a fun soap opera to watch. Like there's the medical content makes me want to like yell at my screen.
So on the topic of like seeing like pregnant people, do you guys get a lot of pregnant people in the ER? Because I don't know, like I know in Ontario, after 20 weeks, you go to like a labor and delivery, I believe it is.
So yes, so same here, like above 20 weeks, it would go straight up to labor and delivery. The adult site that I work at is our tertiary obstetrical site. So we see a lot of pregnant patients come in. Any sort of pregnant trauma would come into that site as well. But it's not uncommon for me to see people in their first trimester that are coming in with concerns for miscarriage or, things like an ectopic pregnancy. Or kind of in the early second trimester before 20 weeks that are coming in with issues as well. And so, yeah, we do see a lot of pregnant patients come in under 20 weeks, like you said.
So I'd be curious, like, do all ER doctors get extensive training in prenatal or pregnancy patients, or is it something that's not as in depth?
So there is training in residency in obstetrics and gynecology. So we know how to deliver babies if there's not enough time to get upstairs to the labor and delivery ward. We do a lot of training in kind of first trimester first trimester pregnancy loss or first trimester complications. So we see that not only in our obstetrics and gynecology rotation, but also in the years of training that we do in the emerge as well, because we do see a lot of patients come in with that over the course of our residency.
I find that when I used to go in, because I had hyperemesis gravida, but I would go to the urgent care, I wouldn't go to the actual hospital. But they would prioritize pregnant patients. I don't know if that was just, I would come in on a day that they didn't have severe cases, but I always found that when I was just there to get an IV at like the discretion of my OB or something, they would always see me very quickly.
Yeah, and so the whether like so pregnancy can affect your triage score. So that's likely why that is why we see pregnant patients more quickly because that is kind of calculated into the triage score. And so certainly we try to prioritize because things can deteriorate quickly, right? So if somebody has hyperemesis, there's a high risk of dehydration, or if somebody has bleeding in pregnancy, there's a high risk of kind of deterioration from too much bleeding. And so those are things that can become unstable quite quickly, which is why the triage is prioritized.
And then postpartum, what would you kind of say is the most common thing that you're seeing for the birthing moms themselves?
Yeah, so lots of patients in the postpartum period will come in as well with ongoing bleeding, for example, or post C-section concerns about a surgical infection. There are often patients that we come in where they have like a bit of retained placenta that's in there, which is not safe for a mom to still have, like because that can lead to ongoing bleeding or an increased risk of infection, for example. Um, Moms who are breastfeeding can often come in with like ductal abscesses or like infection because of a blocked duct. So a blocked duct is not a big deal in and of itself, but it can develop into an infection if it's not kind of managed appropriately. And so, yeah, lots of those types of presentations in the postpartum period.
So would you say there's something specific that people are kind of, you know how they say a lot of times that women fall through the cracks of the medical system? Would you say that you see a lot of that within pregnant women or postpartum women, or that there's things that are going on that are kind of missed per se?
Yeah, I think so. A big reason for that, not only necessarily in the kind of obs-gyne space, but even just beyond that. So in like the cardiology space or other things, we know that women are under researched when it comes to medical research, that a lot of the medical information or teaching that we get in medical school and residency is based on data from men. And we also know that women present differently. And so thankfully, we are starting to have a lot more conversations about this. And there is a lot of research funding and initiatives that are going forward to increase the amount of females presented or kind of included in research, but also to do women only research so that we know and can better understand how things present in women in particular. Another area that has like kind of a lack of research is like perimenopause and menopause. This has always been something, in the patriarchy of medicine and honestly the patriarchy of the world in general that has always really been male dominated. Lady problems, quote unquote, have always been underrepresented and under-researched and dismissed. And so we are, again, thankfully starting to have a lot more conversations about this, not only in, podcasts like this, but in the social media space, in the traditional media space, where we are starting to thankfully see more and more research in these areas so that women can actually get the care that they need and deserve.
I don't know if you can actually answer this, but why is it from a medical standpoint that they've always been excluded or not included to the degree of men in studies?
Yeah, because men run the world right now, really. If I'm being completely honest, it's because men are still in positions of power from a research perspective in medicine and most other professions. Hundred even as early as 100 years ago, like women were not allowed to be in professions like law or dentistry or medicine, accounting, like any sort of like profession, engineering. And so because these were male dominated professions, there were a lot of assumptions made that, well, like females are just like men, except they, have two X chromosomes and they behave exactly the same. And so because it was male dominated professions and men who were doing the research and developing the research, there were a lot of assumptions made about extrapolating what the data that we get from men and applying it to women. And we've now, thankfully, realized and pointed out that that's actually not how things work, and starting to see a change in that.
So I don't know if it's actually just been the last couple of years, but I've clued in the last couple of years just because of my schooling, that even throughout my research and undergrad and whatnot, that it's usually men participant. But is that just become a understanding in the medical field, or has this always been like men or women are known to be underrepresented?
I think that it's been more highlighted recently that as we've been learning more about how women truly do present differently, it's become much more apparent that we are focusing our research more on men and that it is not directly relatable to women. And so I would say it's come to light in the last decade or so that it is um, not applicable, not always applicable to women. I think you bring up a good point about like research participants too, right? There are a lot more barriers for women to participate in research. They're often the primary caregiver when there are children in the household. They're generally even when it's two working parents, the women tend to be the managers of the household and doing all the other, like unpaid labor in the house. And so it is much more challenging to recruit female participants in research as well.
Yes, I was just going to say that I find that I've been asked to do a clinical trial, and I just started thinking how my life would revolve around a clinical trial because I have kids, I have school, I have a house, I have all these things that I can't just drop something and go do all of these medical tests, right? And I find too that one thing that I find frustrating is that research is so behind. So, for example, my friend who has celiac, she's in a clinical trial, but she's not going to get any information for years to come. And you almost want that right away. When you find out
Yeah.
you've been diagnosed with something, or, and it's very rarely been tested or research, it's frustrating as the person going through it. And I'm sure you guys see that as on the other end as a doctor, that so much more research needs to be into it, or that women actually need to be the participants. But
hmm But there's this lag time. Yeah, and it's like that's like the double-edged sword of doing proper medical research, right? Like as a master's student yourself, you know the importance of time and enough participants to and like so just for the listeners, the reason that research takes so much time is because we want to follow, drugs or treatments for long enough to be able to tease out adverse effects or, potential negative effects. And if you only have a sample size of like 10 people, you will miss a lot of things. The more, and so, because if something is only 0.5% or even 0.1%, you're probably not going to see that in a group of 10 people or 100 people or even 1,000 people necessarily. And so that's why it's important to have large research studies that recruit as many patients as possible so that we can tease out what the rare side effects are and watch for them or see if there are any particular patterns that are developing or see if maybe over time side effects or adverse effects develop, not just in the first month or first year, but maybe over the next like 2 or 3 years, there could be unintended consequences. And so even after, like, for example, a treatment goes to market, there's an entire phase of clinical trials called phase 4 trials that look at aftermarket things where like to make sure that as it is, available to the general population, are there any signals or things that we're starting to see now that we have, millions of people taking this medication where we are noticing any adverse effects? And so research is rigorous from a safety standpoint, but the double-edged sword part about that is it means that it's slow because we want to be as safe as possible. So it makes it really tricky.
yes, and even the ethical standpoint of things. Like I did a whole year course on the ethics of, and I did my minor in sociology. So we had to do so much stuff with like the ethical board and just seeing how as soon as that there's a potential to harm somebody, you have to stop. And I know that that's a huge thing with pregnant women and children.
And it's really hard to research on pregnant women and children for that exact reason because of the ethical implications of it. Absolutely. And I think you also bring up a really good point because in Western medicine or like medical research, as soon as you see a negative impact, you stop and you stop and you take a step back and like look at it closely to see if it's actually safe and ethical to continue. When you look at the supplement industry and the like holistic health and wellness industry, they are not held to the same standards as the pharmaceutical industry is. And so there's a lot of negative talk about the pharmaceutical industry. That could be a whole separate conversation. But when it comes to like the FDA and Health Canada and the equivalent in Europe, they are very, very rigorous in terms of safety. And there are lots of different standards and appropriate hoops that pharmaceutical companies need to jump through to make sure that they can demonstrate that their medication is safe. The supplement industry is not subject to that same rigor and scrutiny, which means that they can make all of these claims about, well, this vitamin's gonna, help my hair grow or whatever it is, or it's gonna, fix the bloating that you're feeling because they are not, they can, there are no standards in terms of what claims they can make, and there's no accountability structure that's in place with the supplement industry. And so that makes it really challenging to be in the medical space because I have a professional duty, an ethical duty. I'm held professionally accountable to my college. I can only say things that are true and backed by research. Whereas, Jill, the holistic health coach, can say whatever she wants and sell whatever she wants and make money off of it, and it's not true. So it's a really frustrating and challenging space to be in that kind of vein as well.
Yeah, for sure. And I find too that when you're in that stage of like when you're a first-time mom or you're sick or your children are sick, you're not thinking about these things. And I know like firsthand, so I used to work in a supplement store and I would see people who like overdo it on supplements. And believe it or not, I actually used to eat a lot of cantaloupe and take green supplements. And I mean, like, I would take green supplements twice a day. I started having seizures, you want to call it, as a kid. I was like 16 or 15, whatever. And they found that I had high vitamin A that was linked to
Mm,
supplement intake because I was strongly overdoing it. I was on like this journey of trying to be healthy and working at a supplement store. I thought all these things were great. And in
hmm
that moment, one of my doctors who did all the testing, we couldn't figure it out for like 2 years. Within 6 to 7 months of me stopping, all of my symptoms started to go away. And that's actually one thing that stuck with me, especially in motherhood, that I try so hard never to like give my kids supplements that have not been in clinical trials from third parties, or I try really hard not to do overdo things. Like my family doctor, I don't know if all doctors believe this, but he's like, don't give your kid a multivitamin if they're eating everything and you
Absolutely
know
agree.
there's no
Yep.
deficiencies. Because he's
hmm
like, you're putting
hmm
things into your child's diet or that are you're supplementing things that don't need to be supplemented. If they
Yep.
need B12 or vitamin D, do it separate, but do not do multivitamins. And I used to think he was a little bit like, okay, why? Why are you so against them? But as I'm going, and my child's 4 now, I'm seeing how important that is.
Yeah, absolutely. So like the supplement, so another important point, the supplement industry is worth $6.3 trillion. Dollars. The pharmaceutical industry is worth like $1.5 trillion. Dollars. So it is like a fourfold difference. The supplement industry, like when we talk about big pharma, it's really the big supplement that we're talking about because it is a much more profitable industry than big pharma or than pharmaceuticals are, because of exactly that. Like there is this pervasive narrative of like, well, but it's natural and it's good for you, and why wouldn't you want to like put all these healthy and important vitamins and minerals into your diet? Well, first of all, because it's a waste of money. Multivitamins, like most vitamins, are just water soluble and you pee them out. And if you're having like not even like a very well-rounded diet, just like a generally well-rounded diet, like you're not only eating chicken nuggets, you're going to get what you need in the diet that you're eating. And you don't need to have these multivitamins. So I totally agree with your doctor. And like I said, it's a very profitable industry. Like it preys on the vulnerability of people. When you talked about your journey as a teenager, people also forget that natural things and supplements have negative consequences. They also can be dangerous. There's this whole saying of the doses in the doses in the poison, or the poison is the dose. I can't remember the order of it, but like even something like water in high doses can be life-threatening and toxic. So natural doesn't always mean good. There are lots of, poisons out in the natural world as well. Like eat the wrong mushroom and you die, for example, right? So natural doesn't always mean good, and there are negative consequences of taking these unregulated things that don't actually have research behind them.
Yes, and like my grandmother always says, like there's just new fads every couple weeks or something else that you have to try and it's gonna work. And don't get me wrong, I truly believe in some supplements like iron, for example, or vitamin
hmm
D. Like I
Yep.
think there's some things, but I also know that there's lots of studies and stuff. So it's like you're playing with fire and you're playing roulette because you don't truly know. And so many times I'm told by people, like my son doesn't sleep or my daughter, whatever, they just say, give this supplement, give this supplement. And I'm so scared because they don't test them on kids.
They don't test them on kids and they don't test them as rigorously as pharmaceuticals are. And so you don't, and not only that, the formulations aren't regulated. So when you have, let's say ibuprofen, that is a regulated pharmaceutical, and it says that it's 200 milligrams, it has to be 200 milligrams. Like the Health Canada has this rigorous process where like that has to be accurate. When you have a multivitamin and it says, well, this is how much zinc is in it, not regulated. You actually have no idea that if that's actually how much zinc is in it. And so that's another important thing to point out as well. Like the regulation and the rigor is important from a safety standpoint too.
Yeah, so on the note of ibuprofen, I know so many times people say just give your kid Tylenol or Advil, like if they're teething or if they're just fussy. Is that something that could actually harm your kid, or is that like something that it's okay to do if you think your child's teething, but there's no fever, you don't know if they're actually in pain?
So acetaminophen or Tylenol and ibuprofen is like the brand name Advil or Motrin. Those are medications that are either for pain or for fever. So they kind of both can treat pain and or fever. And so when it comes to, for example, fevers, what I say to parents are that a fever is not dangerous. So if your child has a fever and they're running around and eating and happy, you don't need to treat it because the fever itself is not dangerous. But if they are clingy and not drinking, and you can clearly see that they're uncomfortable, please treat them to make them more comfortable. It is safe to treat them as long as you follow the dosing instructions and there are no, underlying health conditions where your doctor has told you not to take either one of those medications. It is safe to use those medications. The only caveat is if you have a child who's immunocompromised or under the age of 3 months, we actually want to know when they have a fever and you should come in for a fever with that because it could indicate a serious infection. But in general, those are safe medications to take. Same thing for pain. If your child is teething and they clearly look uncomfortable, if they, bump their elbow and have an injury and they're clearly uncomfortable, it is safe to use those medications with the dosing, as long as you're following the dosing guidelines and you've made sure from your doctor that it's not unsafe to take that medication for your child for any particular reason.
Do you see that a lot of parents are hesitant to give their children Tylenol or Advil, or is that something that people usually just like, oh, I gave my child it?
Yes and no. So like one group of people that often come in with fevers, they are like not necessarily scared, but just uncertain because it's not a medication that they've used before. So they're not certain like what dose should I use? Is it safe to use? How often should I use it? Am I giving too much? So there are often parents that come in, their child has a fever and they haven't actually treated it yet because they're uncertain on how to use it. A pharmacist is a really good resource for that, to chat with them about what's the appropriate dosing and time frame for your child. Um, or they have used it and they're like, oh, but the fever came back. And so that then requires some education just on, this is how long the medication lasts. Sometimes it won't take the fever away, but that doesn't mean that the fever is bad or dangerous. And it is okay to, like use both in certain circumstances as well. And so just doing some education and some expectation setting is important in those situations too.
Yes, I'm super lucky because my best friend's mom is a pharmacist and I text her about everything possible, especially breastfeeding. So many times people think, oh, you're breastfeeding, you can't take that. I've heard that so many times, even about like taking Advil. I know you can't take it in pregnancy, but I remember being postpartum taking a leave for something, a migraine, and somebody saying to me, like, you can't take that, you're breastfeeding. It's going to go into your breast milk.
Yeah, and so that's a really good point because, and like again, a pharmacist is a really good resource for that because we have, thankfully, this is an area that has been studied well in terms of like looking at what like the concentration of medications that end up in breast milk, and then beyond that, then how much actually ends up in your breastfeeding child. There is good data on that and good kind of criteria in terms of like what is safe to use and what isn't safe to use in breastfeeding.
So we definitely touched on a lot of things that are frustrating or kind of a challenge being an ER doctor, but what's something that keeps you going? Because I'm sure I can see it when you talk that you're so passionate about what you do and you definitely love your career. What are those moments that you go home or even just you walk out of a room and you say, this is my why?
It is so great and like these cases happen like maybe once every couple of weeks, sometimes, once or twice a month, where beyond the chaos of the emergency department, I really feel like I can look someone in the eye and have a moment with them and feel like I have been able to like give them everything that I can in terms of their medical care and have made a difference in their world. And like, I get a thank you, right? We get to share a moment together, even if it's like situations where I'm breaking bad news. I have these moments where I get to just like slow down and be present with the patient in front of me. And it's a really good reminder of like why I decided to do this because it's about that human connection and that human interaction that I have the privilege of having with my patients and being able to be reminded of that every once in a while is it's not every day, certainly not every day, but being able to be reminded of that every once in a while is what keeps me going.
Yes, well, it's definitely like, especially being a mom, I'm sure you resonate so much more with women, with mothers, with children. And, like when people can resonate and connect with a doctor, I think that it's so important and so much more valuable than just not being able to get on the same level with somebody. You know what I mean?
Absolutely. And like when I'm seeing a patient that like is at one of the same intersections in my life, like whether it's, they're a woman or a mom or a professional or, a person of color, whatever it is, I have all the time in the world for those patients because it's someone that I can just like empathize with on a completely different level. And I really try to make sure that I like spend that extra bit of time with them just to, for new moms, for example. I just saw a new mom last night that was worried about something like those extra minutes of just being able to sit with them, listen to their questions, answer the questions that they need, and just provide the reassurance that I can from the perspective of also having gone through that scary and vulnerable and hormonal time of being a new mom too.
Yeah, so one a doctor actually said to me that they remember every patient, and maybe not to every degree, but they see a name, they see a face, they can connect the two that, and so many people think, oh, that doctor will never remember me, or that doctor won't remember that she changed my life, or she saved my life because she caught my appendicitis, or, and like when she kind of told me her perspective of things, it really made me realize like you guys are doing this like wholeheartedly from the bottom of your hearts, right?
We remember a lot of the patients that we see, and there are things, and especially the cases that are hard and sad and devastating. Those are ones that we carry for the rest of our lives. Like they're the things that keep us up at night, and the things that we kind of like file away in that little box inside that we think about a lot. And so it's not an often talked about thing in medicine. There's, I think, this sterility to medicine where people just think, well, a doctor in a white coat that's just, doing their job, making their money. But these are things that impact our hearts and our souls that we carry for the rest of our lives.
Yeah, for sure. Well, I definitely appreciate you coming on today. Is there one last thing you kind of want to share with our listeners today?
Um, I think, we have talked about a lot today, but I think the thing that I would send you home with is just to remember that we're all humans. We're all trying to do the best that we can. And whether it's a connection with your doctor or someone that you don't necessarily agree with that, you're talking to on the street, just remember that at the end of the day, we're all humans. We have this connection ability as humans with each other. And if we just give each other that grace, whether in a professional interaction or a personal interaction, I think the world would get along a lot better.
Amazing. I truly thank you for coming on today.
Thanks so much for having me.
And we'll see you all again next week at 8 o'clock.